Hey guys, welcome to Mexa Academy. I am Aaron, and today we will be doing an NCLEX review on DKA, so let's begin with our first question. A 19-year-old with type 1 diabetes arrives with vomiting, abdominal pain, deep rapid breathing, and fruity breath. Vitals: HR 128, BP 94/58, RR 28, SpO2 98%. Glucose 560 mg per deciliter. Which provider order should the nurse implement first? Correct answer is option B. Let's break this down into steps. So what is DKA? Diabetic ketoacidosis is called DKA. DKA is a serious condition. It happens most often in people with type 1 diabetes. DKA happens when the body does not have enough insulin. Insulin is very important. Insulin works like a key. This key allows sugar, also called glucose, to enter the body's cells. The cells use this sugar for energy. When there is no insulin, the key is missing. Because the key is missing, sugar cannot enter the cells. The sugar stays stuck in the blood. This causes the blood sugar level to rise very high. Even though there is a lot of sugar in the blood, the cells cannot use it. The cells begin to starve. When the cells are starving, the body panics. The body looks for another way to make energy. Instead of using sugar, the body starts breaking down fat. When fat is broken down, it creates substances called ketones. Ketones are acids. Acid in the blood is dangerous. At the same time, the high blood sugar causes the body to lose a lot of water. The sugar pulls water out through the urine. This makes the body very dry. This causes severe dehydration. So in diabetic ketoacidosis, three major problems happen together. The blood sugar becomes very high. Acidic ketones build up in the blood. And the body becomes dangerously dehydrated. All of this together is called diabetic ketoacidosis. Now let's move on to step 2. Why is the patient breathing fast? The reason the patient is breathing deep and fast is because of a special breathing pattern called Kussmaul breathing. Kussmaul breathing happens when the blood becomes too acidic. In diabetic ketoacidosis, the body makes substances called ketones. Ketones are acids. Acid in the blood is very dangerous. The body does not like acid, so the body tries to get rid of the acid as quickly as possible. One of the fastest ways to remove acid is through the lungs. When a person breathes faster and deeper, more acid is pushed out of the body. This is why the breathing looks deep. This is why the breathing looks fast. This breathing is not caused by fear or lung disease. This breathing is the body trying to protect itself. You can think of it as the body trying to blow the acid out. The fruity smell on the breath happens for a simple reason. One type of ketone is called acetone. Acetone has a sweet, fruity smell. When the patient breathes out, the acetone leaves the body. That is why the breath smells fruity. The next question is why fluids are always given first in diabetic ketoacidosis. In DKA, the most immediate danger is not the high blood sugar itself. The real emergency is severe dehydration. When blood sugar rises to very high levels, it changes how the body handles water. Glucose pulls fluid out of the tissues and into the urine. As the kidneys work to remove excess sugar, large amounts of water are lost at the same time. Over several hours, this constant fluid loss causes the circulating blood volume to fall. As the volume drops, blood pressure begins to decrease. When blood pressure falls, vital organs such as the brain and kidneys receive less blood flow. The heart responds by beating faster in an attempt to maintain circulation. This is why patients with DKA often appear weak, tachycardic, and hypertensive. If this fluid loss is not corrected promptly, the patient can progress into shock. Shock can lead to kidney failure, altered consciousness, and permanent organ damage. For this reason, restoring fluid volume is the first priority in treatment. Intravenous fluids refill the blood vessels and stabilize circulation. They improve blood pressure and restore perfusion to critical organs. They also support kidney function, allowing the body to begin clearing excess glucose more effectively. Once circulation is stabilized, insulin can be started safely. Giving insulin before adequate fluid replacement increases the risk of dangerous blood pressure drops and electrolyte shifts. This is why the order of treatment matters. In diabetic ketoacidosis, hydration comes first. Insulin follows only after the body is stabilized. That sequence is what keeps the patient safe. After fluids are started, the next important concern in diabetic ketoacidosis is potassium. Potassium is a mineral that helps the heart beat in a steady rhythm. In DKA, the body loses large amounts of potassium through urine. Even if the blood test shows a normal or high potassium level at first, the total amount of potassium in the body is actually low. This is very important to understand. When insulin treatment begins, potassium moves from the blood into the cells. If the potassium level is already low, this movement can cause the blood potassium to drop suddenly. When potassium drops too low, the heart can develop dangerous rhythm problems. Because of this risk, potassium levels must always be checked before starting insulin. If potassium is very low, insulin is delayed until potassium is replaced. This step protects the heart and keeps the patient safe. Once potassium is at a safe level, insulin treatment can begin. Insulin is given through an intravenous infusion. Insulin allows sugar to move out of the blood and into the cells. Insulin also stops the body from breaking down fat. When fat breakdown stops, ketone production decreases. As ketones decrease, the acid level in the blood begins to improve. While insulin is running, blood sugar levels start to fall. As the sugar level drops, another adjustment is needed. Dextrose, which is a form of sugar, is added to the intravenous fluids. This may seem confusing at first. Dextrose is added so insulin can continue working safely. The insulin is needed to clear the acid, not just to lower the sugar. Adding dextrose prevents the blood sugar from dropping too low while treatment continues. Throughout this process, the nurse closely monitors vital signs, blood glucose, electrolytes, and urine output. The goal is not only to lower the blood sugar. The real goal is to fix the acid problem inside the body. Diabetic ketoacidosis is considered resolved when the acid is gone. This is shown by a closed anion gap and improving blood pH. At this point, the patient is slowly transitioned from intravenous insulin to regular insulin injections. This transition is done carefully to prevent the condition from returning. Once the patient is stable, education becomes very important. The patient is taught how to manage insulin, monitor blood sugar, and follow sick day rules. These steps help prevent diabetic ketoacidosis from happening again. This entire process works together to safely correct diabetic ketoacidosis and protect the patient's life. Now let's move on to question 2. So here a patient with diabetic ketoacidosis has a potassium level of 2.9 mEq/L and a glucose level of 580 mg per deciliter. An insulin infusion is prescribed. What should the nurse do? The correct answer is option C. Insulin should be held. Potassium should be replaced first. Even though diabetic ketoacidosis is caused by a lack of insulin, insulin cannot always be started right away. This is because of potassium. Potassium is very important for the heart. In diabetic ketoacidosis, the body loses a large amount of potassium. This happens because high blood sugar causes frequent urination. When the patient urinates, potassium leaves the body with the fluid. So even though the body is low in potassium, the blood test at the beginning can be misleading. In this question, the potassium level is 2.9. This level is already too low. Low potassium is dangerous. The heart needs potassium to beat in a normal rhythm. When potassium drops too low, dangerous heart rhythm problems can occur. Now here is the most important point. Insulin pushes potassium into the cells. This is a normal effect of insulin. If insulin is started when potassium is already low, the potassium in the blood will drop even more. This drop can happen very quickly. When potassium drops suddenly, the heart can stop or develop fatal rhythms. Because of this risk, insulin must be delayed. Potassium must be replaced first. Once potassium reaches a safe level, insulin can then be started safely. The other options are not safe. Starting insulin right away can worsen the potassium problem. Giving a smaller dose of insulin does not remove the risk. Bicarbonate is not needed in this situation and can lower potassium even more. The key idea to remember is simple. If potassium is low, protect the heart first. Replace potassium before giving insulin. That is why option C is the correct answer. Now let's move on to question 3. So here a patient with DKA is receiving insulin therapy. The blood glucose level has decreased to 210 mg per deciliter, but the anion gap remains elevated. What action should the nurse anticipate next? The correct answer is option B. Dextrose should be added to the intravenous fluids. In diabetic ketoacidosis, treatment is not finished just because the blood sugar improves. DKA has two problems that must be fixed. The first problem is high blood sugar. The second problem is acid in the blood caused by ketones. Insulin is used to treat both problems. It lowers blood sugar, and it stops ketone production. In this situation, the blood glucose has dropped to 210. That looks better, but the anion gap is still high. A high anion gap means acid is still present in the blood. This tells us that DKA is not resolved yet. If insulin is stopped now, the body will start making ketones again. That can cause the acid problem to return. At the same time, continuing insulin without any change could cause low blood sugar. Low blood sugar is dangerous. To prevent this, dextrose is added to the IV fluids. Dextrose is a form of sugar. It protects the blood sugar level. This allows insulin to keep running safely. The insulin continues clearing ketones. The acid level slowly improves. Stopping insulin or switching too early to injections can cause DKA to come back. Stopping fluids can worsen dehydration. The goal is to keep insulin running until the acid problem is fixed. When the anion gap closes, DKA is resolved. That is why dextrose is added. And that is why option B is correct. Now let's move on to question 4. So which finding best indicates that diabetic ketoacidosis has resolved? The correct answer is option D. Diabetic ketoacidosis is not resolved just because the blood sugar improves. In DKA, there are two major problems. One problem is high blood sugar. The second problem is acid in the blood caused by ketones. Treatment must fix both problems. The anion gap is a lab value that tells us if acid is still present in the blood. When the anion gap is high, acid is still there. When the anion gap closes, it means the ketones have been cleared. Blood pH tells us how acidic the blood is. As the pH moves back toward normal, the acid problem is improving. So when the anion gap has closed and the blood pH is improving, DKA is truly resolving. The other options do not confirm this. Blood sugar can improve before the acid problem is fixed. A patient being able to eat does not tell us what is happening in the blood. Urine ketones can lag behind and are not reliable for resolution. The key point to remember is this. DKA is resolved when the acid is gone. That is shown by a closed anion gap and an improving blood pH. That is why option D is the correct answer. Thank you for watching. If this explanation helped you understand the topic better, make sure you subscribe to the channel. On this channel, you'll learn nursing concepts step by step, in a simple way, with daily NGN style questions to help you think like the NCLEX. Also, join our Telegram channel for daily practice questions, quick reviews, and exam tips to stay consistent with your preparation. Keep learning, stay consistent, and I'll see you in the next lesson.